Okay, class, we're ready to start our treatment. We have determined that yes, massage is the safe and appropriate modality. We have talked about the treatment outcomes, whether they're positive or negative. Our client is fully educated and has given consent. And now we are getting prepared. Okay, so what does that look like? So when it comes down to our product, okay, whether this be an oil, a lotion, a cream, or maybe you're not going to choose any product whatsoever, it really comes down to how much skin drag you want. Some products are going to help you increase skin drag. This is ideal when you're doing some kind of stripping or when you really want that pull on the tissue. Obviously, this is going to be more intense for your client, so you're always going to be checking in that way. When we want to have less skin drag, we're going to try to choose a product that is a little bit more viscous, okay? This is going to be ideal for flushing, it's ideal for tissue recovery, and it's perfect for anybody that's kind of touch sensitive, okay? And obvious rule of thumb, always check with our clients with allergies or sensitivities and make sure they're okay with any kind of smell. Now let's talk about client positioning and draping, okay? So this is where I'm going to have my friend Kelsey join us. Class, say hi to Kelsey. So it's important here to listen to how much direction I'm giving her to make it as easy as possible for her to follow along with what I want to do. So Kelsey, I'm gonna have you lay on your back, put your head at this end, put your feet there, and you're gonna lay face up. Okay. So right off the bat, I always think, does she wanna have a pillow under her head? So Kelsey, would you like a pillow under your head?
I'd love one.
Perfect. Here you are. Is that comfortable?
It's great.
Perfect. Now, whenever we have outstretched legs like this, the risk is that we're adding a little bit of pressure to the low back, so I always like to use a bolster under the knee, okay? So Kelsey, I'm gonna have you bend your knees slightly and I'm gonna slide this bolster right under there. How does that feel?
Great.
Perfect, okay. So let's suppose that Kelsey has an anterior thigh injury and we're going to look at draping and using pillows to support that and sort of just walk through what these things might look like, okay? So for me as a massage therapist, I typically will always have some kind of sheet to use. As physios, you guys might be more used to having towels or some kind of scrub wear for the clients. It really just depends. You kind of just have to make do with what you have. So we're just going to cover her up. I always find it important to only uncover the body part we're about to work on, okay? This helps to create nonverbal parameters on what the client can expect in a treatment. I'm never going to go past the barrier that I've created, okay? So if I've tucked something in around the leg or around the hip, I'm never going to slide my fingers under there. I'm more likely going to reestablish the barrier and then follow that new line just to enforce that type of trust and respect between me and my client. I always want them to know what the limit is, and I also always want to give them the chance to give me feedback on what's comfortable, okay? So the first thing is I'm just going to sort of generally uncover the anterior thigh. I'm gonna come in, I'm gonna tuck in my sheet right under the heavy part of the hip. I'm gonna follow that line of her pelvis down to the medial leg, and you know, since we're supposing that her anterior thigh is injured, I'm going to help lift the load of her leg, okay? So I'm going to sort of gently push into my little bolster, tuck my hand under her knee. I'm going to help her lift up her leg, and I'm really going to give myself a lot of sheet on this side to play around with, okay? So what I like a lot about having a lot of sheet this way is that then I can add this and tuck this under here, or perhaps I can say, Kelsey, how about you hold on to this draping yourself, and I can give her both ends to then control that with her own hand, okay? So this is particularly helpful, of course, when we're working with straight up anterior thigh or perhaps lateral thigh, and of course this lower leg, right? But let's say I want to get into her medial thigh, okay? So I could just sort of gently rotate this open, but even better, I can use another pillow to help support. And what I want to do is create even more external rotation, almost putting her in that figure 4 position, okay? So Kelsey, we're gonna help lift up your leg. I'm gonna tuck this pillow right under there, and we're gonna rotate this open, and feel free to tighten or loosen this as you see fit, okay? So now in this position, I know that her dignity is respected. I now have complete access to the medial thigh, and treatment can progress, okay? Now let's say we're done. I'm not just gonna rip this pillow away. I'm obviously not gonna be a jerk. I'm just gonna nicely lift that away, help her put her leg down. I'm gonna direct her with where I want her hand to go, which is just on top of her belly. I'm gonna gently undrape her leg, like so. Easy peasy. Now, let's look at what it's like to drape and undrape anterior upper body, okay? So for this, I'm gonna need my little towel. So first thing, let's suppose I'm working on a man. And just because a man doesn't have breasts the way that women do, doesn't mean that I want to completely undrape his upper body to work with wherever I want to work with. I still want to be respectful and only uncover the part of him that I'm about to work on, okay? Now with Kelsey here, let's say I want to get into some part of her upper ribs and perhaps some underarm and lateral rib area, kind of lateral to the breast tissue, okay? So I'm gonna grab my little towel. I'm gonna explain to Kelsey, I'm gonna cover up your breasts here, and what I want you to do is pinch this towel at both ends and hold that in place, and I'm going to ever gently, just really slowly pull this down in a very controlled way so she knows what to expect, all the way to the end there. Perfect. I can even sort of tuck this in. That way her armpit is sort of pinching that towel in place. Same thing with this side. And I'm kind of directing her hands wherever I want them to go, okay? So since we're here, let's suppose we're going to do some abdominal work, okay? So Kelsey, I'm gonna gently lift up your shirt here. And I'm gonna take my bottom sheet and I'm gonna tuck this in to the top of her shorts, always wanting to protect her clothing from whatever product I'm about to use. And then of course the opposite way, I'm going to tuck the towel in and expose her belly a little bit more. Now I have access to her abdomen. Maybe I want to tuck this up a little higher and I have access to her lower ribs, or perhaps I want to pull this down a little lower and that gives me access to anterior hip. Okay, so a couple different options there. Now let's suppose we want to do that upper rib work, that lateral rib work, sort of on the outside of her breast and potentially getting into her armpit area, okay? So what I might do is say, Kelsey, I want to work into your armpit area along the ribs on the outside of your breast. Is this okay?
Yes.
Perfect. So for this, I'm going to help you move your arm up and above your head.
Okay.
Just like so. Is your arm comfortable there?
Feels good.
Perfect. Okay. Now I'm going to grab her other hand. I'm going to help direct her where to go. Her hand is right in my hand. I'm going to place it right on her breast, and I'm going to kind of direct her very physically to how much pull I want her to have. If I don't need any breast tissue moved, I don't need any breast tissue moved. But if I need her to pull herself to the side, this is the best way to do it. Okay? So in this position, this lets me have access to a few different spots. Okay? So maybe I have access to lower ribs like so. Maybe I have access to very lateral ribs, sort of getting into the rotator cuff under the armpit. Or maybe I'm going to pull this down slightly. Now I can access her subclavicular area and pec major, pec minor insertion, that type of thing. Okay? So likewise, when I'm all done, I'm going to recover that. I'm going to help her reposition her arm. And then I'm likely to just grab the whole sheet, cover herself back up. Always check in. Kelsey, how do you feel?
Feel good.
Perfect. Okay. There's some draping in the supine position. Let's explore the side lying position, okay? So Kelsey, I want you to lay in a side lying position. So what you're going to do is get yourself over to one side, knees together, facing me. Do you need help?
Nope, I'm okay.
Perfect. Good, good. Okay. And that pillow is comfortable?
Yes.
Okay. So since she's on her side, even though her knees are together, it does put a slight amount of pressure in anterior hips. And I particularly don't want any kind of rotation forward. And so I'm gonna put a pillow in between her knees, okay? So Kelsey, I'm gonna put this pillow in between your knees. I'm gonna help lift your leg up and above this pillow. Good, good. How does that feel?
Feels good.
Perfect, okay. So when I think about what I use the side lying position for, I predominantly use it with anybody that has any kind of limited mobility, okay? Anybody that does not comfortably have the capacity to flip themselves over from one side to the other, side lying is really the safest bet. Obviously, anybody that can't lay in that prone position, so we think of anybody that's pregnant, or perhaps someone just does not want to lay face down, which of course as therapists we absolutely respect. But because they're in this position, it really helps, gravity really helps to pull that abdominal tissue out to the side. So this really helps to expose the iliac crest. And so once we find it with our fingers, we can sort of feel our way posteriorly and maybe land on QL and deep into erectors eventually, or we can follow it forward and anteriorly find that ASIS. And of course, just medial to that is where we start to dig in and find the hip flexors. And so a few different functional access points regarding these muscles. When I think of other times that I use side lying, I think of the work I do with athletes or anybody that, you know, that lateral leg is something that you want to focus on, okay? So in this position, this really helps me to stack my joints if I'm doing some kind of compression in lateral hips, okay? One of my favorite ways to work on your tensor fascia lata or glute min, even a little bit of glute med, this is a great position. Let's say I wanted to do some kind of forearm stripping or some kind of palmar stripping of the IT band. This is fantastic. And of course, follow that down into lateral lower leg. If I wanted to get really creative, Kelsey, I'm going to help you straighten your lower leg here. Okay. So if I wanted to get really creative, here's this really great access. Maybe you can't see it so great on camera, but we will go through this in class. Now I have really good access to that medial line of the tibia. Of course, this is where we see a lot of shin splints, and it's even really good for footwork. Okay. Now, in thinking about what side lying can do for the upper part of the body, this is really great access for rotator cuff. So let me move to the front of the table here and listen to my direction on how I set Kelsey up, okay? So Kelsey, can I have your lower arm? Okay, so we're going to put your palm to the ceiling and create a U shape with your hand, okay? This is going to let us bring your elbow right into your palm and support your own arm up. How does that feel?
Feels good.
Perfect. So from here, of course, I have great access to the lats. I have great access to the intercostals. I can follow this up right into the teres muscles, right into subscap. I can even follow triceps down and get into there as well. Posteriorly, I can come back here. Now I have great access to infraspinatus. I can get into supraspinatus. And what I like to do in this position is it allows me to move the scapula around, articulating it up and down and forwards and backwards along the ribs. So this really helps with people that have any kind of just general shoulder restriction. It's really nice to sort of passively move that scapula around. Just like everything else, now that I'm done with her shoulder work, I want to direct her with how to come out of this position, okay? So Kelsey, I'm going to help you lay your arm across your body. Feel free to do whatever you want with that leg. I'm going to gently remove this pillow here, knees together, and we're all done.